It's a pleasure joining you today for this very important occasion, which is uh, on civil military coordination in humanitarian response, expanding the evidence base. First, I want to thank Brown University, and specifically my appreciation goes to Adam Levin and Seth Stullen for the opportunity they gave us, myself and Dan Oliveri. We are the researchers for this particular presentation on community perception of military involvement in epidemic response in the Northeast region of Nigeria, implications for civil military relations. Just to say this presentation was conducted in the research was conducted in Nigeria with specific focus on the Northeast region. And as we continue with the presentation, you will see the justification as to why the Northeast region of Nigeria was picked as against other regions in the country. The presentation starts with three interesting quotes from the field, from the respondents that we interviewed in the field regarding their perception of military involvement in epidemic response in the context of the Northeast region of Nigeria. The first was from a community leader in the Northeast, particularly Yola, Adamawa State. He said, "My initial view of the Nigerian military has been one that views it as an institution that is made up of men and women that are trained to fight on behalf of the country, with their involvement in providing medical assistance to civilians. My ignorance about what the military represents has been altered." The other quotation came from a military officer in Maiduguri, Borno State. Right now, Borno State is the epicenter of insurgency in Nigeria. For Adamawa and Yobe, we've seen a decline in the frequency and intensity of deadly attacks in these two states, unlike Borno, where the insurgents are still actively involved in some deadly attacks against communities as well as the Nigerian state. So a military officer in Maiduguri, Borno State said, "Through our involvement in the provision of medical support to victims of insurgency in the Northeast region of Nigeria, we were able to win the hearts and minds of the people. This is one way of using the soft approach to gain the confidence of the people during times of conflict." The last but not the least quotation came from a military officer at the military headquarters in Abuja, and the military headquarters coordinates all the military response in the context of fight against insurgency in Nigeria. He said, "When you see the military involved in pandemic response or any health-related issue in the country, and the Northeast region in particular, it is in line with our constitutional mandate under what is referred to as military aid to civil authorities, MACA, related to the disaster management and humanitarian assistance, not involving the use of firearms. Unlike military aid to civil power, which involves the use of kinetic force, aids to civil authorities involve the use of kinetic force, particularly the humanitarian assistance operations, which the military is largely involved in, that focus on the protection of civilians as well as some other immediate protection measures that civilian communities require." In terms of the introduction, what we did in the introduction is to provide a context within which this study was conducted. First is to appreciate the location where this research was conducted. That for over a decade, the Northeast region of Nigeria has been plagued by violence perpetrated by the armed group known as Jamaatul Ahil Sunnah Leader Wa'itawal Jihad, JAS, popularly known as Boko Haram. The humanitarian crisis in this region has affected 29.6 million people, with 2.2 million people internally displaced and over 190,000 people fled to Niger, Chad, and Cameroon as refugees. And one problem that these vulnerable communities face is the outbreak of infectious diseases. Since many of the health facilities, many of the infrastructure that are supposed to provide all the basic services that communities require have been broken down, they become vulnerable. And one of the ways to measure, to see this vulnerability is in the spread of infectious diseases. The Nigerian Center for Disease Control and the National Disaster Response Plan were key instruments through which the whole issue of coordination and the development of comprehensive strategy to deal with internal emergency in Nigeria can be appreciated. Within the framework of the NDRP, the military was identified as very central to the success of emergency coordination and response in Nigeria. And despite the common goals recognized by both military and civilian entities, there are several gaps that are evident in the context of civil-military coordination in epidemic response, which we'll see in this research. Examples of some of such include misunderstanding of the role of the military, frustrations regarding various human rights abuses within the military, and a lack of community trust in the military. Other challenges to civil-military coordination include confusion about the military's role, cultural barriers, and human rights violations. Structures that promote civilian cooperation include civil society inclusion, military public health outreach, as well as improved human rights in the context of civil-military reporting and channeling. Now, we also tried to look at the literature on civil-military engagements during epidemic response. Current literature on community perceptions of military involvement in health crisis response typically focus on the effectiveness of the military and multinational actors. And by multinational actors here, we are talking about both those actors that operate even within a nation, but that there are the multiplicity of actors that are very active in the context of epidemic response outside the military. Scholars have also debated whether shaping the response through the lens of securitization is appropriate, given the obvious medical and public health implications of epidemic response. Some scholars even suggest that military or government-led campaigns against outbreaks and epidemics have been a relatively recent phenomenon. And the situation in Sierra Leone and even Liberia underscores this point in the context of how the military in these countries had to confront huge challenge of dealing with the spread of Ebola. But respondents in the were all noted the Liberia, for instance, the military's use of intimidation, violence, and lack of effectiveness when helping to construct public health facilities or even responding to some of the emergency situations that relates to health in Liberia specifically. And this is also because of the fact that the whole issue around military involvement in pandemic or epidemic response is one phenomenon that is really new in the context of how states and institutions like the military are involved in the fight against, in responding to health-related emergency. In terms of the methodology for this research, the aim of the research was to assess civilian perception and interaction with Nigerian military's involvement in epidemic response, using insights from the military and civilian population. We were able to identify a wide range of respondents that we interviewed both for the KII and the FGD. And the interviews were framed around specific research questions that has to do with the role of the military in pandemic response, understanding some of the existing structures and mechanisms that engender the acceptance of the civilian community in relation to the involvement of the military in epidemic response, specific constraints that make it difficult for the civilian community to support the military in relation to its involvement in epidemic response, some of the guiding principles that define military involvement in epidemic response, some of the existing challenges that affect cooperation and coordination between the civilian community and the military in relation to epidemic response. Also, some of the constraints associated with the military's involvement in epidemic response and how they can be addressed, as well as the ways and to what extent do local contexts influence or impact on the involvement of the military in epidemic response. And lastly, what are some of those effective ways of engendering battles between the civilian population, the civilian and the military population in the context of epidemic response in the region? In terms of the study population and selection of respondents, Adamawa, Borno, and Yobe were selected as the three focal states for this research, and they are all in the Northeast region. From the introduction, you can see the explanation we provided in terms of the huge humanitarian crisis that bedeviled these three states and what makes them really important as key areas of focus. And the military has a significant and active presence in each of these states due to its role in fighting Boko Haram insurgency, as well as the resources they have deployed to support civilians affected by the violence or the insurgency. Within each state also, 3 local governments most directly affected by the Boko Haram insurgency were selected to determine the perception of Nigerian military involvement in both the Boko Haram insurgency and other forms of emergency. We try to ask questions about Ebola, though Ebola was not so rampant in that area, but even their understanding of Ebola, the Ebola epidemic, is one major issue in terms of helping us understand whether there are lessons from the Ebola epidemic that really shaped the way their understanding of the military involvement in epidemic response in this state. In terms of the local government selected included Madagali, Michika, and Yola North in Adamawa State, Maiduguri, Jere, and Damboa in Borno State, as well as Damaturu, Gujba, and Gaidam in Yobe State. The data collection method utilize KII and FGDs, and for the KIIs, we interviewed 65 respondents across all the location, and for the FGDs were conducted in each of the locations with 6 to 7 respondents participating, and they all covered all the key, the targeted audience, community actors, military personnel, representatives from governmental and non-governmental organizations, and other stakeholders. And it is important for us to also note here that special attention was also given to capture the voices of socially vulnerable groups such as women and people living with disabilities in order to obtain views from this category of persons. And in terms of our contextualization of Nigerian military epidemic response, in the wake of the devastation caused by Boko Haram in Nigeria, the military assumed a larger role in humanitarian response. Although the National Emergency Management Agency and the State Emergency Management Agency are responsible for coordinating epidemic response, the military has additional logistical and technical capabilities to help deliver immediate assistance to regions mostly in need. And this is a responsibility that the military was able to discharge quite well, as we will see in subsequent slides. Experiences and lessons from the involvement of the military in pandemic response demonstrates that the Nigerian military is prepared for contingency operations and that the military might be able to assume a larger role in health-related emergency. As a result, As a result, the Nigerian military prepares for humanitarian emergencies and contingencies in accordance with Section 2172, subsection C of the Constitution, which fundamentally incorporates the statutory mandate of assistance to civil authorities into humanitarian response and operations for the Nigerian military. The framework of the National Disaster Response Plan also identified the military as a central actor in national emergency response and coordinations. Now, we try to look at selected cases on Nigeria's military epidemic response. The first is the case in 2019. In response to the outbreak of the polio virus in Nigeria, the Chief of Army Staff, Lieutenant General Tukur Buratai, launched what was called the Theater Command Buratai Initiative Task Force in 2019. The task force was a partnership between the Nigerian military and state-level healthcare service providers in order to ensure that an estimated 60,484 children that were trapped in 2,622 inaccessible settlements in the Northeast region were reached. Nigerian military's response to COVID-19 was one of such examples also, which through the Nigerian Air Force, which commenced the production and the lifting of liquefied oxygen to be distributed to the isolation centers established for the treatment of COVID-19 victims across. And because of the airlifting capability of the Nigerian Air Force, it was able to dispatch all the liquefied oxygen that were produced to the respective area isolation centers across the country. The Nigerian Air Force was also able to airlift a team of health officials of the Nigerian Center for Disease Control from Congo Brazzaville, where they were stranded due to the closure of air and land borders as a result of the COVID-19. The Defense Industries Corporation of Nigeria, DICON, is a parastatal under the Ministry of Defense with mandate for the production of defense equipment, also was able to produce ventilators as part of its strategic intervention in responding to the COVID-19 situation in the country. Now, in this next slide that discusses the results of this research, we did what we call a selection of voices on the military's role in epidemic response. We were able to identify 3 broad voices. The first category of voices are the positive voices, those who spoke about the positive role of the military, as well as the second group that spoke about the negative role of the military. And the third category is that category that has mixed feelings about the role of the military. Now, in terms of the positive role, some of the respondents argued that, 1, the military played the role of restoring peace in response to violent attacks in communities and other associated danger. 2, we don't know much about the role of the military, but they have assisted in many ways, such as providing medical services, providing ambulances for those that are critically ill. The other said, we are actually from Dikwa, a village from Borno State. The military assisted us in providing security and help with respect to transportation. And the last but not the least in that category is that the role of the military is to defend the territories of the Nigerian state. We can also be called upon by the civilian to provide aid in situations of insecurity, like we have been doing in some cases. In terms of the negative perception, the first year said the community's perception of military in pandemic response is poor because they are sometimes seen to cause unrest in the community. The second said they, referring to the military now, are not friendly and their role in such sector is limited. The third person said military looters are not healthy for the community at all. the last but not the least under this category, said actually in some locations there are constraints because some of our military boys, once there is issue of insurgency, they will use that as an advantage against the community, like the use of rape, forced pregnancies, amongst others. In terms of those mixed voices we captured, some of the comments, feedback arising from that interaction was: one, generally the military's role in relation to pandemic response is not encouraging, but they are sometimes involved in conveying victims of bomb blasts to hospitals. Two, the only role of the military in pandemic response is the conveyance of the injured to the hospital during intense period of the insurgency. They do not play another role as far as law is concerned. Wow. The other said one of the basic challenges is the refusal of the community to accept such intervention. This can result from many factors such as religion, culture, or the nature of relationship between the military and the people. For instance, many people may reject polio vaccine due largely to religion. There are some slight typographical errors in the slide. So the last but not the least in that category said, so what I'm saying is that bad behavior of the military can make people reject medical aid of the military in pandemic situation or epidemic situation, so to speak. In terms of the discussion also centered around opportunities for improved civil-military relations. Civil-military interaction in Nigeria demonstrates a successful model as well as provides opportunities for improvement in countries such as Nigeria that are still developing in terms of their ability to deal with this issue of epidemic. And the example of strategies to promote civil-military collaboration include the military participation in public health campaigns, involvement of civilian leaders in military outreach, and partnership with local organizations such as the Nigerian Red Cross. And in that context, involvement of local health personnel through the Nigerian Red Cross, who might have a better understanding of local norms and community acceptance, has the potential of enhancing civil-military acceptance and cooperation in order to better deal with epidemics in those communities. Additional examples of organizations the Nigerian military could partner with include local community health centers. These are scattered and they are spread across communities in the country, representatives from corresponding local government areas, and lastly, the businesses of community leaders in the context of how they are also mainstream in this kind of discussion. It is important to also note that the military's role might extend beyond the provision of security during epidemic response. In the context of COVID-19, the evolving role of the Nigerian military will be was extended to the construction of field hospitals to increase healthcare capacities during such times. Now, in terms of the recommendations for this research, we made 5 key recommendations. The first is about deepening understanding of local context, and at this point is quite important based on the fact that the credibility and effectiveness of the military is directly related to the quality of interaction with the civilian population, which can best be achieved through a more nuanced understanding of the local context. So where the military understands the local context, it is better able to relate more freely and get the buy-in of the civilian population. Expansion of military doctrine. This research also argued and advocated for the broadening of military doctrines from civilian protection against its enemies to include civilian protection against diseases, which calls for a transformation within the military to strengthen its skills and expertise against unconventional threats to human security, such as the outbreak of diseases and other health-related challenges. The third recommendation is about building community trust in dealing with epidemics, expanding the military community involvement during times of stability and in non-military areas might promote civil-military cooperation during crisis situation. And there are many examples of such where the strategic relationship that is bolstered by trust between the civilian communities or the civilian population and the military is able to help build and sustain the cooperation that exists between the military and the civilian population. The fourth recommendation is about strategic partnerships in dealing with epidemics. Research demonstrates the opportunity for a strategic partnership between civilian and military sectors in epidemic response. And by leveraging on such strategic partnerships, the capacity of the Nigerian military would be bolstered and better positioned for more effective outcome. And we can see that coming quite clearly in the context of how the military is playing a leading role as one of the key focal points for both the discussion on pandemics, policy decisions on pandemic, as well as implementation of strategies relating to pandemic. And the last point around recommendation is on the need to utilize military resources for more robust responses. And one of such is in the administration of polio vaccines to geographically inaccessible mountainous areas in Nigeria. And in this context, the military administered the polio vaccines in hard-to-reach areas across Adamawa, Borno, and Yobe State. Also, the airlifting capacity of the Air Force was utilized in the distribution of health-related equipment in response to COVID-19, particularly in hard-to-reach communities across the country. Now, two key limitations from this research is the fact that, one, it is important to know that KIA and FGDs were conducted before the 2020 COVID-19 pandemics, meaning that the respondents interviewed did not refer to the military's involvement in COVID-19 response. And the last limitation, or the second limitation, is the fact that civil-military relations might strongly differ in other regions of Nigeria, and therefore generalization of the research to all of Nigeria there should be caution in doing that, given the regional differences in both socioeconomic, demographic, cultural, as well as the activities of civil society in those communities and locations in the country. In conclusion, military involvement has become a cornerstone for modern epidemic response, as we see across the world. While some view military participation as a critical element in bridging the gap in relations between the military and civilians, others are skeptical of such actions, citing experiences with the military that were characterized by gross violation of human rights. This research, no doubt, highlights mixed perceptions of military involvement in epidemic response in Nigeria. While some view the participation of the military as a critical element in bridging the gap in civil-military relations, others are really skeptical of such actions. And they are skeptical because of their experiences with the military that is defined or characterized by gross violation of human rights. And this point is really important, bearing in mind the history of Nigeria as well as the history, as well as one in which violation of human rights by the military became a defining feature of relationship between the state and citizens. And many of these communities or the civilian population are still carrying these experiences forward in terms of their nasty interaction with the military, and they still believe that the military is still that institution that is not positioned to really deal with issues around responses to epidemics or even pandemic on a larger scale. Thank you very much. I stop here. I look forward to engaging with all of you as part of the interactive session for this presentation. On behalf of myself and my colleague, Dan Oliver, I want to thank you very much for listening. Thank you.